Hello, this is Dr. Grande. Today the question is, what is the difference between avoidant personality disorder and social anxiety disorder? And I got the idea for this question from a comment that a viewer left on a video looking at the difference between social anxiety disorder and panic disorder. Those two disorders are also similar. But this is an excellent question because avoidant personality disorder is very similar to social anxiety disorder. If you look at the different diagnostic criteria and you look at real-life situations where we suspect avoidant personality disorder or social anxiety disorder, it's quite difficult to tell these two disorders apart. So I would look at it like this. One way we see these two disorders conceptualized is that avoidant personality disorder is a more severe version of social anxiety disorder. Now, I'm not completely sure that this really explains the difference too well, but this is one of the theories, so I want to make sure I cover it. So with this theory, the same factors that contribute to social anxiety disorder contribute to avoidant personality disorder. And if left untreated, social anxiety disorder can end up being avoidant personality disorder. So you have a situation where somebody is fearful about social interactions, they don't feel confident, they have panic attacks as a result many times of particularly stressful social interactions. We can see both of those occurring with these two disorders. So it can make sense to say that avoidant personality disorder is a severe version of social anxiety disorder. So I mentioned before that I'm not sure I quite believe this particular explanation. It doesn't really seem to capture the difference between the disorders. I look at avoidant personality disorder a little bit differently. It is a personality disorder, so we can expect the symptoms to be relatively stable throughout the lifespan. Now, of course, with personality disorders, we do see sometimes an intensification. So somebody will develop the personality disorder at an early age, and over time, the symptoms become worse. But the characteristics of that illness remain fairly stable. And we see that with avoidant personality disorder. A person with this disorder is fearful in social situations, but they also have anxiety symptoms and this general social inhibition all the time. They have trouble developing interpersonal relationships all the time, not just when presented with a stressor, like having to speak in front of other people, for example. This is consistent with personality disorders. This idea that the characteristics do not change a lot. Social anxiety disorder I look at a little differently. It tends to have a cyclic element to it. So somebody can have a panic attack as a result of being in a social situation, one that they have fear surrounding, and the next day they might not be as anxious. A week later they may have nearly forgotten about that incident. And then 2 months in the future, another situation occurs, like a meeting or something where they have to speak in front of other people, and they have this panic attack again. It has this cyclic feel to it, this feel that the stressor is what's contributing to these symptoms a great deal, not necessarily characteristics that the personality would contain. Avoidant personality disorder is different. Somebody with avoidant personality disorder has the symptoms all the time. It doesn't have really a cyclic feel to it like social anxiety disorder. And there's also another level. Somebody with avoidant personality disorder is much more likely to go beyond just that fear of negative evaluation from others. So it's not just a fear of criticism like we would see in social anxiety disorder, but the motives of the individuals that they're fearful of are sometimes called into question. And we could look at this as a lack of insight. So somebody with social anxiety disorder recognizes that they're afraid of this criticism. They don't want this negative evaluation. But they don't necessarily question the motives of the people making that evaluation. Matter of fact, somebody with social anxiety disorder would be fairly likely to say that the panic attack and the fearful symptoms are irrational. They're frustrated by the symptoms and they don't know what causes them. They're not really looking at the outside world and blaming anybody there necessarily, They're just wondering why it's happening to them. That's a level of insight. With avoidant personality disorder, we see less insight. Somebody with avoidant personality disorder would be more likely to question, as I mentioned, question the motives of the people that they're fearful of, and to have this pervasive pattern of distrust of people, to really work to avoid interactions with other people, and they have real difficulty forming relationships. So it's more than just a social stressor and this irrational sense of fear and frustration and a panic attack. It's low self-esteem. It's a feeling of inferiority. It's being suspicious of other people's reasons and believing the worst of them, believing that they'll dislike you without any reason, that in fact other people are the problem. That's a lack of insight. Now, that's not true of every case that we see of avoidant personality disorder, and it's not true of every case of social anxiety disorder that we see a lot of insight. But to me, that's one of the key differences. Another difference would be this idea of etiology. Now, in mental health counseling, etiology is what we refer to as the cause, and usually for us it's a suspected cause. We really don't know what causes a lot of mental illnesses, but we have suspects lined up. So we think, all right, we know trauma can lead to mental health disorders. We know that poor relationships can lead to mental health disorders, stressors of all different types. What is etiological for avoidant personality disorder as compared to social anxiety disorder? And one of the interesting findings of research is that trauma and neglect seem to be causal, seem to contribute to the development of avoidant personality disorder. Now, we can't really say they cause it because we don't know that, but they appear to contribute to the development of that disorder. Now, this actually makes a lot of sense. Remember, it's a personality disorder. So somebody with this disorder has these characteristics most of the time. Doesn't have that cyclic feel that social anxiety disorder has, as I mentioned before. So say somebody is neglected as a child. They start to think that their emotions don't matter. Their self-esteem drops. Their self-confidence drops. And they think of themselves as having the lowest rank and the lowest importance in that family structure. Also, because of that neglect, they don't develop the skills necessary to form close relationships with other people. So as they move out into the larger world, into school, into career, they make an effort to isolate themselves. They have this fear of criticism. They haven't developed these skills to build relationships, so they isolate, and that can lead to more criticism and bullying and shaming. And in response to that, they isolate even more. So this explains, in a sense, where avoidant personality disorder may come from. Again, we don't know for sure, but that could be one area that contributes. And it explains why the symptoms tend to intensify over time. It's a behavior that the individual keeps using, and they believe it's going to help them, but it makes the situation worse. We can think of the development of avoidant personality disorder as a protective mechanism that the individual is using to protect themselves from pain, except the way it's being used repeatedly can actually cause more pain. I hope you found this description of the difference between avoidant personality disorder and social anxiety disorder to be helpful. Thanks for watching.